Hi, everyone. Thank you for joining us for today's ClinicTracker community training series. My name is Alicia, and I'll be taking you through today's topic, which is streamlining your new patient process. Before we get into that topic, though, I do like to remind everybody why we have these webinars, which is to provide you frequent access to product experts like myself so that you can make the most out of your ClinicTracker and billing tracker system. We want to ensure you feel well supported and have the information that you need. So we try to schedule these webinars based on the topics we think you need, based on the questions you're asking through the support system or to your support reps. And we also take your suggestions. So if you do have any suggestions about topics you need to see, please let us know and we'll be happy to add them to your schedule. These are a great way to obtain free training with real-time access to a product expert and input from other people in your field. So we definitely encourage webinar attendance and ideas. Okay. As we go through today's topic, please remember that it is my goal to ensure you get all of the information that you need about this topic and other ClinicTracker billing tracker topics. So if I'm going too fast, or you want me to explain something differently, or you have a question, please raise your hand using the GoToWebinar panel or type your question in, whichever is easier. So if you raise your hand, I'll unmute you. You can speak your question aloud. If you type your question in, I'll see that and I'll answer it right through, talking through the webinar. Okay, those questions are extremely helpful to me, so please don't hesitate to ask them as we do go through today's topic. They help me know that we're getting you the information that you need, and they're actually helpful to your fellow ClinicTracker users because you might have a question that they weren't able to think of. Okay, with all that being said, we'll dive into today's topics and we'll start here. Now, last week, some of you may remember that we had a webinar on streamlining the intake flow. Okay, so we went through all of this first part of the workflow. Okay, and now we're down to the client admitted part. Okay, when a client is admitted in the system, we like to do a couple things. In my demo clinic, we send a welcome message to the patient portal. We assign follow-up clinicians, and we have treatment plans assigned for 30 days after admission, and we repeat that every 90 days. Okay, so we're going to walk through how to program some of these into ClinicTracker so that they're automated processes. Now, when we're talking about assigning the follow-up clinician, we like to remember or know how we're going to assign that. Okay, so some clinics assign a staff assignment manually. So they'll come into the client record under staff assignments, and they'll create the staff assignment by choosing the provider's name and the assignment type, and then they'll save it to the file. Okay, so that's one way to do it. And in that case, we would require the creation of a staff assignment. Another way that you have to do it in ClinicTracker is you can actually have the system create the staff assignment for you when an appointment is created. Okay, so you can do that by coming up here to where it says Admin Config, Automatic Staff Assignments. So in my pretend clinic, I'm just going to step back over to this workflow. In my pretend clinic, this client admitted, that's at an intake session with this intake provider. Okay, and the intake provider in my clinic identifies who's going to be following up with this person, and they schedule that first appointment. Okay, and the way that they go about that is they go into the schedule, they come up here to find available time slot, and then they find the clinician's availability. So they could say, if April's the follow-up, or if Alicia's the follow-up, then I could search, I could set this out, I need to schedule this within the next month or the next 15 days. I can limit it to times of week. You can see I have a lot of availability. Okay, so this is where I could come down and say it's an individual therapy session and double click, and this will book the session for me. I just need to pick the client. Okay, now I have to do things like fill out the program and the service. Okay. And we'll save this for now. Okay, now whenever this linked appointment is created right here, that's when those automatic staff assignments can be triggered. Okay, and those automatic staff assignments automatically create the staff assignment for whoever's listed here when that create linked appointment is created. So it's going to happen as soon as this button is pushed. Okay, but there's also a way to automate that so the system can create these linked appointments for you. Okay, and we'll talk about all of that as we go through today. Okay, so there's a lot to streamline here. There's things like, whoops, sorry. Things like streamlining, finding the appointment. So you saw that instead of manually searching over the next month, what does Alicia have available? I went up here to find available time slot. Okay, and then I searched. In order to use this tool, your clinicians are going to have to configure what's called their scheduling availability. And each clinician can do that individually. They can do it themselves by coming into the scheduler and coming to File, and then Set Scheduling Availability. So File, Set Scheduling Availability. Okay, this is streamlining the scheduling of that first appointment. Set scheduling availability. Once you're here, you can set available and unavailable times. I recommend that you do this for, a day of the week. So you could say like on Mondays from 8 to 5, I'm available for individual therapy sessions. Okay, and you can see I've already saved my availability at the bottom. So if I needed to make changes, I could just double click. And you can see what I'm available for here. And I'll say, you know what, I'm not available for group at that time anymore. So I've just saved the change to that existing record by double clicking and making a change and saving. Okay, so the clinicians can set their availability here. That feeds this find available time slot tool that streamlined finding the scheduling time slot. Okay, I'm just going to run this one more time. Okay, now when I double clicked in here, you'll notice, once I selected a patient, I had to fill out these things here. Okay, but what I could have done is set up some defaults for the staff. Okay, so if I wanted the system to kind of fill those fields out, streamline this process a little bit more, we can do that here on the staff info. So ClinicTracker main screen, staff info. Okay, we're going to use the binocular button right here to select a staff member who's already been entered. And I'm just clicking on the B button on the side here as opposed to typing in my last name. Okay, and I just double clicked and I'm coming to the additional options tab. Now don't worry, you see some tabs I've added in here for example's sake. You can customize your staff info tab as well. But if you don't have those tabs, don't worry about it. Just come to additional options. Okay, and then you'll see here event appointment defaults. Okay, these event and appointment defaults can be set up like this. So I can say when the clinician is Alicia, okay, and it doesn't matter what patient group and for all ages, then the default event type is going to be individual therapy for 60 minutes. The program is going to be couples counseling. The service will be individual therapy for 60 minutes. My supervisor is Mark. Okay, I usually work out of the main building, room number 1. And I have the ability to say I work on certain diagnosis codes so the system can automatically select the right DSM for me. So I'm just going to add a couple codes so you can see how to do that. So I'm just pressing the plus button, searching for the code I need, and I'll just double click here. Okay. When I'm all done, I'll click save. Now the system will just fill in those values for me when the event is scheduled.